The content provided in this video is for educational purposes only and is not medical advice. For medical advice, please schedule an appointment with one of our Hope for Healing providers or the appropriate medical professional. This material is the property of Hope for Healing and is not to be shared or replicated in any way without written consent. Thank you.
I like this first question because I think it is perfect. So for those of you who don't know, April is Stress Awareness Month, right? And so this is the month where we start to kind of focus and see and look at how stress is impacting a body and doing an inventory. So the person wanted to know, what do you personally do to de-stress?
Great question. So for me, I do a couple of things, but one of them is I like to take hot Epsom salt baths. I do a 1-to-1 ratio of Epsom salts to baking soda. Why do you put baking soda in it? It alkalinizes the water. I like to play with my grandson outside. And then my all-time favorite is breathing. So I do something called 4-7-8 breathing. I know we've talked about that before, but you can do it when you lay in your bed at night. You can do it when you wake up in the morning. And then I also have this thing called an Oura ring, and I have an app on my phone, the Oura, and it has some little breathing exercises on it. So breathing is really important. Why? Because when we're stressed, we breathe shallowly. It's called our sympathetic nervous system. That's like you're in the emergency room. Parasympathetic is like the recovery room. That's rest and digest. Because when you're stressed out, are you going to be wanting to put blood into your intestinal organs to digest your food? No, you're going to be all hot and bothered and thinking about everything that's involved. So breathing, hot Epsom salt baths, and fun family time, laughing, telling jokes.
Yes.
So being silly, you put on a smile, it makes endorphins, even if you don't feel happy, but dwelling on what you are grateful for moves you out of that profound stress or whatever you're worried about.
Yeah, that's so important. I feel like I noticed myself, like before I started paying attention to my breathing, I'd noticed myself go like that I hadn't been taking those deep breaths. And when I pay attention and like adding those times, like now I'm thinking about it, like I was usually under a lot of stress and I wasn't taking those deep breaths to support my system. Wow, it's really important. Okay, so the question, I think this is such a valid question, is that though I love hearing all the beautiful ways that you de-stress, the question is like, does stress really impact the body that bad?
Oh my gosh, yes, that's a very valid question. In fact, it's so much easier to do physical labor than have an argument with someone you care about or a disagreement. We get in our head and we think about it. It's emotionally and mentally and physically exhausting when you're dealing with very controversial things. So stress raises our blood pressure, decreases blood flow to our guts. It causes a buildup of inflammatory biochemical byproducts in our body, and we just get stuck in a loop, and our society has not built in time for rest, and it's so important to do that. So yeah, it's very, very valid. In fact, a lot of people that have sought out our practice, we use something called the functional medicine matrix. And at the center of the matrix is mental, emotional, physical. I like to add in spiritual, sexual, because so many of us have been traumatized in so many ways. They're like, well, I'm going to do this, I'm going to do that, I'm going to do this. But if you don't deal with the center of the matrix, you will never heal. And so it's incredibly important to learn to recognize what is stress and things that you can do about it. And you can create systems and schedules in your own life to get to where you want to go. But a lot of times we need help. So getting a therapist, having community. And I'm just going to drive home, especially for a lot of our patients who've been with us for a really long time and you haven't gotten the results that you want. Well, the whole reason that we've transitioned over to assimilating health coaches is because they help with behavior modification. And in our group coaching, you can be a veteran of functional medicine, or you can be brand new to functional medicine, or let's say that you have a child that's high functioning on the autism spectrum, 16, 17, 18 years old, that is learning to speak for themselves. So you find out what the person's looking for, what they love and what they're motivated by. And if you're actively pursuing what makes you happy, then you lower your stress. So, yeah, I wanted to say too, I'm up here in the Woodlands and Lauren's downtown in the medical center office on Bins. And so we're kind of doing this here, and I'm going to let you get back into some more questions.
Yes, I love that you mentioned that, because that's literally what I was going to mention, is that the beauty of technology and the fact that we are 2 locations, same practice, we're able to have these communications virtually. Okay, so I think since we went into health coaching, we're going to head this direction for a little while. One of the common myths that I feel like can happen is, well, first and foremost, people who are in the functional medicine, like, they're usually active learners. They want to know the information and all of that. So what can happen is when someone says, hey, we think you need a health coach, we associate, I need a health coach because I'm weak. Like, we associate it to this whole, I got this, I can do this, and I don't need help. But like, I think that is such a myth. And I'd really love you to kind of step into that myth and really kind of talk about the importance of health coaching, even if you're a high achiever and even if you know things.
Yes. So, I was having a discussion about this with Kara Ware. Kara Ware has been a health coach for over 20 years. She's written a beautiful book about assimilating health coaches into medical practices. And that's what we've decided to do. People think that they have to see a medical provider, and then you cherry pick what you want and apply it, and then you're not getting the results you want and you're mad at us. And I'm like, wait a minute, we need to go back to the basics. So someone says, I'm getting tired, but I know how to eat gluten and dairy free, but I find out they're eating a quart of goat milk yogurt, and that's dairy. So they didn't understand some of the foundational pieces. So for me, drinking enough water is an issue. So hacking with a health coach. I was talking to one of our health coaches. So I have a glass of water with vitamin C in it by my sink at night. It sits there. And then in the morning, I drink that whole glass of water before I go downstairs, take my supplements, get my coffee. And if I drink 2 of these thermoses, and I need other people to help me, so I have my scribe say, hey, Dr. K, do you need a drink? Why don't you take a drink? Or, I just need that prompting. And I'm a smart, intelligent human being, but it's breaking things down into doable pieces. And so it's imperative that we have someone come alongside us as we're walking into functional medicine, finding out you have something wrong with your immune system called chronic inflammatory response syndrome. 25% of the population has that. If you have a health coach to help you navigate the recommendations, the referrals, the medications, the supplements that the medical provider recommends for you, they are the buffer between you, the patient, and me, the medical provider. The health coach makes all these things, pulls it into your current ability. And you know what? You're the ones who are creating and co-creating plans. People want to be told, do this, do that, and have somebody else do it for them. But you're the one who knows you best and knows your child best. So learning how to create a plan within
Mm-hmm.
your current family's readiness. Health coaches help you do that. And the group coaching that we have is for everyone, because
Mm-hmm.
all of us need help. Who would I be to say, oh, I'm perfect, I've arrived? No,
Right.
not at all. I mean, we need to be humble. We need to seek to learn. We need to seek
Mm-hmm.
to understand, and we need to have fun while we're doing it. So health
Mm-hmm.
coaching, group health coaching, is a lower price point with a profound ability to modify how your family does. And it's something you do as a family. You don't just do it to the person. The whole family needs to do it, because functional medicine is about creating a healthy body, creating a healthy life, creating healthy families, and paying it forward to the next generation. So that's what we're trying to do. That's why health
So
coaching is
good.
so important.
That is so good. I think that everything you touched on is so important, especially because I think it almost correlates to that first question, like about stress. So just because we're high achieving, brilliant, smart, intelligent people doesn't mean our stress levels are in good standing, right? And so health coaches kind of step in also to go, hey, you're doing great, but this is also causing you stress. So how can we take what you're doing well and de-stress it, and also optimize I love Dr. K. Oh, you need to talk about this. The fun that you make, you and Tom, for your sleep scores.
Oh yeah. Okay, it's kind of goofy, but my
I love
husband
it.
Tom has an Oura ring, and I do too. So in the morning we upload our results, and it's like we compare our results. It's like, I'll show you mine if you show me yours. And it's like, it's kind of a race. And he's like, how come you always get a better sleep score than me, or blah, blah, blah. And, we're trying to biohack, figure out what we did wrong. Oh, when we went out to dinner at True Food Kitchen, I had a glass of wine. That affected my sleep score. Or I ate too late. You shouldn't eat within 2 hours of the time that you go to sleep, nor should you feed your kids 2 hours, because it will decrease spontaneous release of growth hormone, and you impair your sleep. And you shouldn't have coffee 12 hours before you go to sleep. It's kind of like, oh, caffeine. So yeah, we kind of compare that. It's a example of a marker that tells us important things, because your sleep is something that you need. And yeah, so we have fun doing that.
Well, and that's the fun piece about like where coaching and biohacking comes in. Then you get to invite your community into it. It's not something you do solo. It's something like, whether that is, okay, we're going to like choose to drink more water, which then we can go, okay, how are we going to do that together? And I just think that health coaches have come up with so many amazing tips to kind of help improve your family dynamic. So I think it's great.
Well, one more thing on that is that we all need help. And I have to tell you that I have to be surrounded by people who support me, because if you know my story, I used to weigh almost 300 pounds. I took antidepressant medicine for 27 years. I struggled with profound depression, and now I don't take antidepressant medication. And it's because of my personal precision genetics. But I have an addictive personality, and I need accountability in my family. I can't have garbage in my house, or it's very tempting for me. And so having a family that supports me, a husband who's right on track with me, you know, eating a clean life, having a clean lifestyle, eating clean food. Many times we feel like we're out there on our own, but you need people to come alongside you and have people in your family that are with you to encourage you and motivate you, so you don't fall back into old patterns and addictions.
Yeah. I remember that through group coaching, and that was one of the things. So whenever we were going through the group coaching training and I was going through it, and like the real big highlight on it being a family care plan, and understanding some of the places that I struggled was because it was me in my house. And so, like, for instance, like, guys, I was super addicted to Cheez-Its. I loved them and it was so hard to cut. So when Christopher would bring them into the house and he'd be like, well, you can't have that, I felt like a child. I was like, what do you mean? It's my house, like I'm an adult. And so then I was able to, like, after that group coaching session, I was able to go to Christopher and say, hey, if it's in the house, I can put it in my mouth. And so if you want to support me, we can't have stuff like this in our house, because I'm going to want to eat it on a bad day, or when I'm just frustrated, or when I'm wanting to snack. And to be able to kind of step into that, it helped me facilitate a conversation that was not accusatory, that wasn't like, how dare you, but it was a very calm conversation, like, hey, I really want to get better. This is something that is preventing me from getting better. Can you help me with this? And that's, we talk about communication in group coaching, because that's a hard conversation to have.
Right. And, you don't want to feel like a child, nor do you want to feel like something's wrong with you. And, what's good for a parent and it's good for the whole family. And so it's true. Equipping ourselves with a way to kindly and lovingly communicate with our family members, to be a united front, to support each other and to not tempt each other. Because it's, you need your home to be a safe, healing, peaceful zone.
That's great. Okay, so on nutrition, this is a really good question that was asked, is why are supplements so important when I eat so clean?
Great question. So the soil now, if you've done precision genetics and it shows that genetically you don't make enough of something, then you're going to need to give your body what you need, or disease may show up. You can also eat really, really clean, but the soil is depleted of what it used to have in it. So someone said, well, I don't believe in supplements. I'm just going to get what I get from my food. And it's like, that's a whole point of going, right. Well, why are you showing up to the table with these symptoms? It's because you don't make enough of the enzymes to absorb what's in your food, or the food is depleted of micronutrients, which is so true. Our food now, our soil is not what it was 50, 60, 70 years ago. It's not our grandparents' gardens.
Yeah.
Plus, our environment is so toxic. The exhaust that blows off the highway, the stuff that they spray on your yard, the flame retardant, the garbage, the formaldehyde that's in your dry cleaning stuff. Our bodies are assaulted now with so many more toxins. Environmental toxins are killing people and making people very, very sick. And we're seeing this astronomical increase in the rate of rise of autism and Alzheimer's and dementia and Parkinson's and ALS. So clean diet will not provide what genetically you're missing. And that's why you need lab tests. And that's why you need your precision genetics, because your genes will never change.
Yeah. That is, I mean, that's super important, because it can feel like, but I'm eating healthy, and then I have to do on top of that, but it really is, they come together, they partner.
They do. They do. Supplement. You can't take a bunch of supplements and eat a crappy diet. Don't even bother buying supplements if you're eating a garbagey diet, because then, things get worse. So anyway.
Okay. So why are well child checks so essential when I'm choosing not to vaccinate?
Great question. So, most people think, oh, you have well child checks because you're going to get shots. No, children grow exponentially and they meet developmental milestones when certain parts of their brain develop, and subtle nuances in the developmental delays can show up. So if I have a 7-year-old who's not reading, then hey, something's wrong. And it's like, you haven't been here since they were 4. There's a problem. We need to investigate that. What's going on here? So for little infants, a child has things called primitive reflexes, and then they lose their primitive reflexes. Well, if a child's not losing their primitive reflexes, then something's going on neurologically. So we want to make sure adequate growth, okay, adequate acquisition of developmentally appropriate milestones, their gross motor, fine motor, communication, personal, interactive, social, and adaptive abilities. You know, from 2 and 3, from 2 up, it's every year. But prior to 2, it's very frequent because of developmental milestones. And most children that develop autism, there's usually a clue by 15, 18 months old. It's showing up at the table. And the questionnaires that we ask people to fill out, we read those and we ask questions about them. And if certain things are happening, you know, we want to address it immediately and kind of change the tide or do a course correction. And that's why.
Yeah. I think when people are like, man, our y'all's intake forms are a lot. And I was like, well, your system is a lot. Like you have a lot for us to look into. Like, because we look at every system totally, we have to hear about and hear from every part of you and every part of system. And so that is really good to know. What is the difference between a naturopath and what Hope for Healing provides?
Great question. So a naturopathic physician, some states in the United States, they have prescribing rights. In the state of Texas, they do not. But a naturopathic physician typically goes through a 4-year undergrad at a Bastyr University up in, I think, Oregon or Washington is famous. And then they'll have an internship for maybe 1 year. I don't know all the nuts and bolts, but the providers at Hope for Healing are, I'm an MD, Dr. Brigitte is an MD, and we have pediatric nurse practitioners and FMPs. IFM is different than naturopathic physicians in that we were already allopathic medical providers and, you know, have done a residency like I did and board certification. Same with Dr. Brigitte. We also have DNPs, a doctor of nursing practice, and are maintaining our medical credentials. So we can prescribe prescription medications. Okay. And in many states of the United States, a naturopath, there's also a lot of places that say, oh, I'm a naturopath, but they don't have, it's like, it's, you have to probe deeply because someone can say they're a naturopath in the state of Texas, but they have not had any hands-on clinical training. And if you gave them testing about medical syndromes and things, you wouldn't have that foundation. So naturopaths are absolutely amazing. They study herbal and herbal nutrition, many times alternative care paths and things like that. Like some people go on to do their acupuncture, maybe Chinese medicine, but using herbs and other things to, and supplements to modulate the system. So one naturopath is not equivalent to another naturopath, and you need to look very carefully at their credentials. Just like people can get a PhD in a box, I'm like, you know, they never go into a classroom and they put a PhD behind their name. Well, show me your doctoral studies and your doctoral thesis, and where did you defend it, and that kind of a thing. So an ND usually is not a prescriber, but they can be just as fantastic as an MD, DO, PMP, FMP, DMP. It just depends, you know, it really, one ND is not the same as another. So that's kind of a long drawn out question to that.
No, but I think it's super important, especially because we do have people who come from out of state or have moved from out of state. And so your legislation is different than Texas. So being educated on what that changes in Texas, because I was looking at it the other day and I was like, oh wow, like you don't need nearly as much. So doing your homework and finding that out is very important when selecting a provider. So I really appreciate the very thorough, detailed answer to that. Okay, we're now going to ask a question about our favorite supplement, PEA.
Yes.
Can you take PEA and aspirin at the same time? Or should you, specifically when you're dealing with things like post-surgical, or are there times where it's okay and times where it isn't?
They can be taken together.
Okay, perfect.
Yeah.
I love those ones. Okay, so allergy season, all the pollen. So we would love to know, what are your how do we take care of children's allergies, and then how do we take care of adult allergies?
Okay, so for children, allergies are caused by inflammatory things in our body, histamine releasing cells called mast cells. And there's other systems that cause inflammation. So allopathically, people talk about Benadryl or Zyrtec or Claritin or Allegra. Those inhibit mast cells from going and releasing all their bad guys that make you itchy, swelling up, tearing, snot production, you're hot, red, swollen, and painful from your allergies. We like to use here at Hope for Healing something that goes further up from the mast cell, and that is stabilizing a pathway called stabilizing something called tumor necrosis factor alpha, TNF alpha. So what we use for children typically is DHIS Junior chewables. So based on a child's weight or how bad their symptoms are, we have a loading period of 7 to 10 days of DHIS Junior chewables twice a day. And then you decrease that to pretty much in half and continue. And I like to do allergy support through the end of May because the last tree to bloom in the Houston area are pecans, and they're usually done by the end of May.
Oh, wow.
So,
okay.
Yeah. And for the nose, Xlear nasal spray. Xlear contains xylitol, not a sweetener, but it's a biofilm buster. It's antimicrobial, along with sterile hypertonic saline. So in a little squirt thing. And we have both of those here. For adults, we use DHIST capsules, and an adult does 2 caps 3 times a day for 7 to 10 days. Then they go to 1 to 2 caps a day until the end of May, and the Xlear for adults. That's a simplistic way to address the allergies.
I love that. You said, so you'd take it toward the end of May. When would you start that to kind of get ahead of it?
Well, it really depends. I mean, we started having a lot of allergy stuff at the beginning of February here in Houston.
Okay.
So you can start, it depends. When you start seeing wildflowers, January, February, and just go all the way to the end of May. But then you have to look at the summer weed season and ragweed. So ragweed, specifically ragweed, we have a homeopathic remedy for that called ambrosia. So if a person, when the ragweed starts coming out, it's these little pellets. Here we go. It's ambrosia. I've got it right there, ambrosia. And I do 5 pellets 3 times a day, and just suck on those. Yeah, it relieves hay fever, ambrosia artemisiafolia. But that works really well. And then if people have just really bad eczema, allergies, asthma, we use something called histamine, which is another homeopathic remedy. Not all of our practitioners have gone through the homeopathic training. I did some just clinical application, but we also have classically trained homeopaths that we refer people to Dr. Brenda Placencia, she's in this area. Stacy Oakes, she's an occupational therapist, but she's also a classic homeopath. So sometimes you need like a little tincture and it will help.
Yeah.
But I love Dehist and Exlier and Ambrosia.
That's amazing. Okay, so if I'm in the thick of it though, and it is just, I'm a hot mess, I can't really wait for that loading dose. Are there any like functional therapies that I could do in order to kind of help kickstart or jumpstart that?
Great question. So if somebody is full of mucus, you're sneezing, all that stuff, we have a wonderful little, I believe, like an allergy drip. It's got a lot of vitamin C in it. Then also you can do ozone in the ear and ozone insufflation in the nose. An ozone generator can cost anywhere from high, like around 800, 900, all the way close to 2000. But if you have a family of 4 children, 2 parents, your kids are going to daycare, going to school, they're getting sick all the time. If you get an ozone generator, you can do these therapies at home. The other is acupuncture can really help open up your nose and stuff too. And vitamin C is also a very powerful tool. And even just coming in and getting a little drip, or even some of our boosters, our injections, are very, very helpful for that. But ozone insufflation and our allergy drip help a lot.
That's really good because sometimes I feel like you just need to like jumpstart the process and then kind of get yourself on maintenance. Okay, what do you think are the 3 non-negotiable practices when you are trying to focus on healing your gut?
You have to be gluten free, you have to be dairy free, and you have to poop every day. Those are non-negotiables. So how you get there? So by gluten, I mean barley, rye, oats, wheat, spelt, and then things that are called gluten cross-reactive, meaning pieces of them look like gluten, which is corn, rice, millet, dairy, and yeast. So the dairy crosses into the gluten. And then pooping, everybody needs to poop, but it can't be pellets. So like rabbit dropping. So you need to have a poop that sinks to the bottom of the toilet. It shouldn't be gross and foul, but you got to get it moving out. So red raspberries, 1 cup of red raspberries has more fiber than any other fruit. Get a squatty potty. Get those knees up, and glutathione helps with a leaky gut. So you've got to poop. You need to be gluten-free and dairy-free because they're inflammatory and they feed bugs the wrong way. And those, if you want to heal your gut, that's where you start. Poop every day the right way. Gluten-free oats is an oxymoron because you know how Bob's Red Mill, it'll say gluten-free. Oats, pieces of oats at the molecular level look like gluten to the immune system.
Right.
Rice is the same way, but if you're really wanting your rice and you're just stepwise eliminating things, then you can do wild rice or brown rice once or twice a week as you're getting yourself off of it. So what I like to swap for rice is quinoa that is soaked about 48 hours because it breaks down things called lectins in the outside of the thing, and you just rinse it. And then also cauliflower rice, like Trader Joe's has cauliflower rice, and so does H-E-B. And, I think Kroger does too. Costco, you can buy frozen pouches of cauliflower rice. And, you're none the wiser unless you've got a very discriminating 2-year-old. It's hard. Our kids can be really picky, but you can move yourself to different levels. Now, if you really, really love oats and you've gone gluten-free on everything but just your oats, you could ask your provider to do an IgG and an IgE test for oats. One of my kids loves her oats. So she's like, I can give up all the other, but I want to have I love my oats, mom. And so we tested her immunoglobulin G and immunoglobulin E, and she cleared. And I said, okay, I give you permission to have oats.
That's perfect.
So, yeah.
There's ways to check that. Okay. So the question we have here, and this may be a bit specific, but this is more of like, how would we go? What does that process look like? Is what methods would you use to get to the root cause of seizures and possibly other types of seizures? Oh, absent seizures, and possibly other types of seizures active in an 8-year-old.
Yeah. So what seizures are abnormal electrical activity in the brain. And then it shows up with symptoms like staring. And then you think of people that you see on the movies with, they're jerking like this. That's called a grand mal seizure. But absence, they may be blinking. So I utilize the precision genetics because our mitochondria are what fuel our nervous system. But also we have to look at electrolyte channels, because what changes the electrical potential of the cells in the brain. So you have to lower inflammation. So if I was seeing a child for the first time presenting to the clinic or any of our providers with absence seizures or any other types of seizures, we would say we must have the precision genetics that we put together, because we can look at how the brain regenerates. That's what we call our neurotropic factors. There's 3 of them. And then we would also look at inflammatory markers, because the microglia are like the Pac-Man of the brain. What if those microglia don't have an off switch and they're just like doing this and they're not cleaning up the brain, and they need to be calmed down so they're not releasing inflammatory messengers causing seizures, okay? Lowering the electrical threshold. So then also the precision genetics not only show us neurotropic and inflammatory, but then we look at methylation, the ability to get fuel into the mitochondria with methylfolate, and then mitochondrial pathways. So precision genetics would be my first stop. And then an anti-inflammatory food plan, so that we take away anything that's causing inflammation in the body. And also environment. Okay. And it depends what other kinds of symptoms somebody's showing up with. But what if, and this is in the medical literature, what if, unbeknownst to you, you have a wall cavity that's growing buttloads of mold, and it's right next to your child's bedroom? I've had this happen in the clinic. And we find out that your home is full of mold. So environmental testing, that's what we recommend. Precision genetics, anti-inflammatory food plan. Our group coaching helps with the anti-inflammatory and integrating these practices. And then testing your environment, which we talk about in the group coaching, and we give you access to the testing kits. Don't hire a mold inspector. It costs too much money. You may not need a mold inspector. Do the testing yourself instead of having somebody come in and say, oh, it's fine. It has to be done right, and you don't want to waste your money. And then you always do an EEG. You already know that. You do an MRI of the brain. There's also something that pediatric neurologists do. They do special testing, chromosomal microarray, looking for certain genetic abnormalities that's not on our precision genetics that ties to seizure activity. And then a lot of times we'll get an MRI of the brain to see if structurally, maybe this child or adult has an absence of structures in the brain where fibers cross that lower the seizure threshold producing. And then lastly, because we also had a child referred by Texas Children's Department of Pediatric Neurology here in the Woodlands, and she had a single circulating autoantibody to her brain.
Wow.
And she was on all these seizure meds that weren't controlling the seizures. And by addressing her brain autoimmunity with the IVIG, that's the treatment for the seizures. So anyway, that's how I address it. Very
No, I think
involved.
that's brilliant. But that's the point though, right? Is when you're dealing with any part of our body, and that's where people are like, man, you have a lot. It's like, well, because we have to look at it from different angles to ensure there's like there you're safe and secure. And so thank you for walking us through that process. Um, are there ways to lower inflammation and biomarkers apart from sulforaphane and PEA-SU support?
Yes. Diet, diet. Don't put gluten in your diet. Don't put casein in your diet. That's the protein in dairy. Don't eat processed sugar. You know, if you want something sweet, go with coconut sugar, other options. Opening up detoxification pathways, dry brush, rebounding, getting the lymphatic to improve. You can lower biomarkers, inflammatory biomarkers, by making sure that you have an adequate airway and you're not having sleep apnea or obstructive sleep apnea. So if you're an adult, you may need a sleep study. You know, a lot of dentists do those now, but we can also order them. We have cash and insurance based. If you can't clean your brain out, then that's going to stop things. The other is it's absolutely imperative. It's not just mold that causes chronic inflammatory response. It's also actinomycetes, which is a bacteria, and it's come to the forefront, and it is just as bad and as much as a driver as mold is. So, and then vector-borne illness. So sulforaphane extra strength is a broccoli seed extract derivative, binders, but lymphatic drainage, rebounding, dry brush, sauna, and lowering the stress in your life.
Yeah.
Yeah, and that's going to make your biomarkers improve too. So it's like looking at everything, what's going on. Yeah, so that's what I'd focus. Oh, PEA, CBD, low-dose naltrexone, sulforaphane extra strength, glutathione. If you haven't had precision genetics, please get precision genetics done. And IV therapy. If you want to lower your biomarkers, do our chronic infection drip. Or detoxification drip, because it's going to speed things up.
Yeah,
so
absolutely. I feel like that is one of the things, right? Because this process too, which you always say is that you didn't get sick overnight, you're not going to get well overnight. But I think sometimes when people want that needle mover coming in, we're like, that's why we have functional therapies, to get the needle moving faster, to move towards health and wellness.
Yes, IV ozone is profound with that too. I mean, I try to do ozone, and I myself get 3,500 milligrams of glutathione every time I do a drip.
Oh, wow.
That's a lot of glutathione. I worked up to that. It's high dose, but it keeps me healthy and allows me to run circles around our providers and our team up here. So
there you go. Okay, so because you mentioned this, this was some questions that even kind of correlate to the last Dr. K with Q&A with Dr. K, is how to test for, I'm going to read both of them because I think you're going to be able to wrap them all together, is how to test for actinomycetes skin colonizations that you spoke about. How do you treat it? In addition to that, how do you test for actinos invading the skin and the body after leaving a severe water damage and moldy home?
Yeah, that's a really good question. So what is it? How do we test it, and how do we treat it? So we have a skin swab for actinomycetes because it's a family of bacteria, and mold doesn't travel alone. It travels with bacteria travels with it. And in fact, when you're in a water damaged building, you know how you go in and something smells a little funny? It's probably more the bacteria than the mold. So when you leave a water damaged area, you can do a skin swab. But the thing about actino is that it doesn't involve remediation. It's bacteria, it's not mold. So it involves decreasing the colony count on your skin and in your body. So you take a binder while you're decolonizing, but if it's growing in your nose with Marcons or in your airway or it's in your gut, you need a binder like cholestyramine, the most powerful binder that there is, or Welchol. We also have ochrapepsin. There's other binders. And then you, on a daily basis, everyone in the family exfoliates, because where does actino like to live? It likes to live in the greasy substance called sebum that's on our face and our scalp.
Oh,
So
wow.
for 6 to 8 weeks, you daily shower, you daily exfoliate, and there's a whole actino protocol, but you test on Envirobiomics. You can do an ERMI or a HERTZ-Me2 and the actino home test. It's using just a wipe, and then you can do the skin test separately too. And then, but everybody in the family needs to participate. So 6 to 8 weeks, you are literally, because when we take a shower, our skin cells are heavy and that actino goes everywhere. You breathe it in, you breathe it out, it sits in your gut, because when you breathe in, stuff sits in the back of your throat, you swallow it, colonizes your gut, colonizes your skin, your scalp. If you have dandruff, if you have seborrheic dermatitis, you probably have actinomycetes. If you have eczema, you probably have actino. So what we like to use, I recommend people do a do-it-yourself exfoliant, like a sugar, maybe honey scrub in the shower, because that's cheap. Salt might burn. And you need a HEPA vacuum that you can literally vacuum your ceiling and vacuum your walls and vacuum your floors. You need to change your bedding twice a week, and maybe even HEPA vacuum your mattress, because skin cells are heavy and they fall and they go everywhere. And you got to HEPA vacuum your floors, do your laundry every day so that stuff isn't sitting around and, you know, being puffed out into the environment. And the thing is, you can't see it. So it's like so hard to think about. And then you retest, you can test your walls just the way you do an ERMI, your ceiling fans, and then test your skin. And it may take 2 rounds, because some people have an astronomical amount because it lives in the mouth. If you have periodontal disease, if you have bad breath, it can live in the sinuses. So we do ozone in the nose, drink ozonated water, put it in the ears, do the decolonization, exfoliation, and clean your structure. And we have that on a handout, and you can test. And yes, you can lower the colony count. And the thing is, a lot of bacteria are always with us, but you can decrease it. Now, there is like a witch hazel and EDTA topical that you can use, but it's exceedingly expensive. So we're kind of thinking outside the box on other ways to do that for folks. But it's a work in progress. So yeah.
Absolutely. Okay. What can I do for EMF sensitivity?
EMF sensitivity.
Yes.
Electromagnetic fields. For your home. Oh, wow. I'm so glad you brought that up. Here it is. You can use an EMF meter to see if devices in your home are producing a lot of electromagnetic fields. And you can also use for your phone, it's by RadiArmor, RADI. Oh, there's my lovely grandson. It's called RadiArmor, and this blocks EMF, so you can put it up to your ear like that. You can use headsets like this instead of the Bluetooth things when you're doing calls and things. And then you can also use an EMF blocking laptop shield. And I'm just going to go boom. You see this blue thing on my desk. Yep. That's called Defender Shield. I use that on my desk every day. And, you know, you don't want to sit with your laptop over your gonads. So meaning your ovaries and your testicles, and irradiate them all day and every day. Right. So having covers that block EMF, and then you can also hook up with a company that measures for, there's a difference between electromagnetic fields and then dirty electricity. So there's a company, I believe, called Clear Light, and there's a little device that you can purchase to plug in each of your outlets in your home to find out if you have dirty electricity. And it has ways to make sure that there's not a lot of stuff coming on to you. And you can also turn off your Wi-Fi and router at night to decrease your EMF. And you can also, like in one of our closets, we have our breaker box. We covered it with a copper cloth that we purchased from Defender Pro or Defend Shield. I forget what they're called. It's Defender Pad to block some of the EMF. So there you have it.
Absolutely.
Yeah. Okay. There's a few things there.
Yes. Okay. So this is super exciting. I like this question because it's also an event that will be coming up in the next couple, either next month or the following month. But I thought you may want to speak into some of this. Is what are some kid approved gluten-free and dairy-free breakfast ideas? Right now, I'm currently struggling really hard.
Okay. Great question. So eggs, you can do gluten-free, corn-free, non-toxic, chicken sausage, the little gluten-free, corn-free hot dogs. You can do, you want to get some protein and fat, so you can do little smoothies. And we have something called the phytonutrient spectrum. Oh yeah, Norma put in there egg cups. Yeah, I mean, like right before. So, you know, kids are typically picky, but if you want ideas, so we're going to have an anti-inflammatory snacks and foods, but our health coaches in Mighty Networks, we've got a thing that Brandy did, but we can pull in some breakfast things. So things that stick to your ribs, and you can have dinner for breakfast. So if you want to do like a chicken sausage, a turkey sausage, little egg cups, your fruit smoothies with maybe some avocado, and they don't even know there's avocado in there. And I like chickpea, so you could even do like a chickpea pasta because it's full of protein. Maybe do some shrimp with it, even for breakfast. I know that sounds crazy, but it's like dinner for breakfast. It sticks to their ribs instead of a bunch of carbs. And Dr. Boyajian, Dr. Tony downtown, her little boy asked for salmon for breakfast, blueberries, salmon. I mean, just beautiful. It's our society thinks you need to have dessert for breakfast, carborama, and people wonder why their kids don't pay attention and they're having meltdowns.
Right.
They're
Focus
eating
issues.
Fruit Loops.
Absolutely. Yes. So as Dr. K mentioned, next Tuesday, we are going to be having a anti-inflammatory snacks on the go. For those of you who are members, it's completely free to you. And for those of you who aren't members, it's $10. I think like plus taxes or something turns out to be like $13, but it's going to be absolutely amazing. But the reason why we mentioned that, and I love the question about breakfast, is because what we are doing is actually going to take you through the day. So we're going to do anti-inflammatory snacks, then we're going to do anti-inflammatory breakfasts, anti-inflammatory lunches, and to ensure that you know. And so how to do this, because we have been getting so many questions about like, okay, I get the importance. Now, how do I do it? Our health coaches are getting together to create events for you all to empower y'all to be able to do the things that y'all are believing and hearing about. Okay, let's see. Y'all asked so many amazing questions that we are having to put some of these into next month. But one of the questions we had come up is that, are there any new ADHD supplements to help with focus and hyperactivity? So that's actually a question that was asked 3 times. So I wanted to make sure it got into this.
So when we think about inattentiveness and inability to focus, And that'll show up to the table differently. Little boys tend to be more active. Little girls tend to just zone out, or you can have both. I'm not trying to stereotype, but a lot of times that's how that shows up. So doing precision genetics or just even the neurotransmitter panel will help us to determine where you need support. So ProGAD Enhancer helps with inattentiveness and hyperactivity. Okay. That's something that we carry for based on if you have GAD1 or GAD2, glutamic acid decarboxylase. These are also a lot of times the kids that go to get rid of the glutamate in their body. And then when they hit the pillow, they collapse, or they go to bed and they can't shut their mind down. Full focus is another dopamine producing supplement that you take every day, every morning, based on your genetics. We don't want to just say whatever. Then there's advanced neurotransmitter support, which is similar to full focus, but a little different. And then I love OptiMag Neuro because it delivers magnesium L-threonate to the brain to calm it down if you've got an anxiety with a focus and inattentiveness issue. But then what is ADD, ADHD? Well, it's usually inflammation, methylation, and also neurotransmitter issues. So zinc and copper ratios are very important too, because if that ratio is off, you show up with a lot of hyperactivity, tics, and those kind of things. Somebody asked also, do we do IV? Are IV drips good for kids? And I'm like, absolutely. We have quite a few children receiving IV therapy that we tested. We showed that they have issues, but you don't even have to be, well, and it depends what it's for. We can do IV glutathione right around a surgical procedure to pull out some of that anesthesia and to open up detox pathways and clear the anesthesia out. I have quite a few kids that come in and have IV ozone, IV therapy that are recovering from vector-borne illness like Lyme, Bartonella, Babesia. And we have some amazing pediatric nurses. We have Imelda, who's actually on the vascular access team at Texas Children's The Woodlands. She finds IVs, she puts in lines for children, and we have an ultrasound machine.
Yes.
And Norma Dean, I worked with Norma at St. Luke's for several years, and she's joined our team, and she's outstanding. And then Nicole, who's another Texas Children's pediatric nurse. And then Lindsay, who's downtown on Thursdays, which we're trying to build up the schedule so Lindsay can do more. But Lindsay is also a Texas Children's House supervisor and has been for almost 10 years now. So we have pediatric nurses who put in IVs and we give them to children. We have all kinds of fun ways to help children feel better. We use something called Buzzy on the skin to distract them. We have numbing cream if we need it, all kinds of things. Distraction.
Yeah. So in light of the question about focus and attention, do we have any IV drips that help with that?
Yes, we have a focus drip and we have some boosters. Yeah, so we have a focus drip that you can receive, and then CoQ10 fuels the mitochondria. You can get that. You can get some B complex with it and things called methyl donors. So lower the inflammation, improve your focus by having these drips.
What I love specifically about Hope for Healing is that we don't take things like ADHD and ADD and isolate it as this. We need to find a medication that gets you focused. We look at the whole system and what is causing that and try to target that system, which again, Dr. K talks about precision genetics. You'll hear us talk about it all the time because that is like such a base of how we can look at everything and make sure we are actually treating you personalized, which I think is very much different than other Other ways that you would do it, oh, just give me a pill for this or a pill for that, but versus we want to actually take care of what's happening in your child or your body. And so I really appreciate the way that you've given us your time, and also just so educated us on so many questions that we had. Also, I want to say, like, we have these every single month. And so for the questions that we didn't get to, we're going to make sure that we have another one scheduled. But you can also replay these back. So whenever they are free Q&A with Dr. Case, they will be on our YouTube channel that you can check out, and you can check out the past ones, or you can look at our membership program and you're on Mighty Networks. All of the videos will be there for your viewing as well. Thank you so much for your time, Dr. K.
Thank you, Lauren.